Kia ora mai tātou, ngā mihi mahana kia koutou katoa. It's a great pleasure to be here in Otautahi, just our mihi to mana whenua who are looking after many of you today, and many of you are obviously from here. And no doubt you had a wonderful morning today, and sorry I wasn't able to join you. So, nā uria hau te tai tukiro ngā mihi kia koutou, ngā iwi o Ngāpui Nui Tonu me Tararawa. So my people are from Northland, and it's my great pleasure to be here with you this afternoon to give you a bit of an aspect of some of the conversations in regards to if we're thinking about zero suicide, but particularly from a practice perspective, what might that look like in terms of our health systems here in Aotearoa. We've got a little bit of time, so my perspective will touch on Māori, and Denise will talk about our Pacifica, and we'll talk to you a little bit about what we've been doing in the time that we have together. So kia ora koutou. Many of you have seen these provisional suicide statistics here in Aotearoa, but the point of bringing these situations to you today, of course, is really around the relevancy of our problem here in Aotearoa and in New Zealand. We know that for those of us that are here in this room and no doubt interested in this very touchy and sensitive topic, that Māori rates of self-harm and suicide have not decreased but are increasing. We know that Māori rates of suicide are 1.6 times more than that of non-Māori. Our Māori men, particularly in the ages of 15 to 24, are twice as likely to take their own lives, unfortunately, at that same age. What we've seen just in the period of time also concerned, and just to give you a little bit of a background, I do come from a mental health nursing background. 20 years ago was trained as a clinician, worked mainly in adult mental health services and kaupapa Māori, and have worked across both NGO, DHB and iwi haura provider contexts. I'm currently the CEO for Rau Matatini, which is a national Māori workforce development organisation, and I'll talk to you a little bit about why we're in this space at the moment. So we're presently aware, of course, as I've said, about the situation for us as Māori and Indigenous people here in Aotearoa. And we have noted that the number of Māori female have been taking their lives also, and are 3 times more likely to do so than of non-Māori women. We do know that our youth rates overall here in New Zealand are not the best to be spouting about, and particularly in this group, Māori are more likely to take their lives, almost 3 times more likely than non-Māori. Some of the work that we've been doing in Rau Matatini, we've been particularly aware in the communities that we are connected to and working amongst, is that there are a number of us also taking our lives in Australia. And for some of the communities that are able to repatriate their loved ones back to their traditional resting grounds, it is also adding more stress and impact on many of our Māori communities, and of course here in New Zealand we do not count those statistics. So we contacted the Bureau of Statistics in Australia just recently to see if in fact we could unpack or get a bit of a determination of what is going on over there. And of course we are aware they have different coronial systems across their states, but what they did be able to inform us was that certainly there seemed to be a bit of an increase of New Zealand-born people in Australia taking their lives. However, they couldn't tell us how many of those might be Māori. We can only go on the track with what we've been told by whānau hapu iwi across New Zealand about them bringing their loved ones back from Australia after taking their lives. So that adds another dynamic to our situation here in New Zealand. Oh, you jumped there. That's cool. 4 years ago, when the Associate Minister was Tariana Turia, and within the Ministry of Health, under the previous suicide prevention strategy, they made it really clear that there needed to be more done in regards to building capacity and capability for Māori and Pacifica. As an outcome of that, these 4 objectives came to be, which were sitting in the last strategy, that were very much about building the capacity, capability of whānau hapu iwi and Pacifica communities in a very broad sense. What they wanted to look at doing was to ensure that our communities could understand, to understand the situations in regards to what might lead to self-harm and suicide, but more importantly to develop the knowledge and the skills to respond effectively and safely in those communities. We also were tasked with exploring to see what was available within our communities and across New Zealand in regards to culturally relevant training, education and information for our people. Also the opportunity to build our own evidence base, so very much about findings and evaluation to see what is working, and also to build leadership for suicide prevention, if you can imagine that. Oh, actually, we'll go back, hey?
Go back?
Yeah, sorry. Thank you, sir. What it has meant is that a number of things in a very short amount of time. This is the very first opportunity in New Zealand to have a national Māori and Pasifika suicide prevention program delivered here in New Zealand together. Waka haurua was used as a double hull waka to symbolise our common traditions in the Pacific, and for both Māori and Pasifika to work together within our respective communities. This has given us an opportunity to do a number of things. We were provided a one-off fund from the ministry to administer to different community groups, and near 70 groups across New Zealand had the opportunity to build their own capability and capacity and the understanding about how to build their own resilience and understanding about the issues associated with suicide and how to prevent it, and also how to respond should it happen. All of that work has been evaluated and published. We're really lucky at Rau Matatini that we administer Te Mauri, which is an Indigenous journal that's peer-reviewed and online and international. And in September, just recently, we presented the findings, and in the next edition in December, we'll be continuing to present the findings out of Waka haurua. There are other things, but in the interest of time, I'll get on to the next quarter. So, a bit of a change in tact. One of the awesome things about the zero suicide philosophy for us is certainly aspirational. I'm grateful again to have heard the GC, the Gold Coast, present what they're doing in Australia. But here in New Zealand, we still require some work, particularly if we're going to be thinking about improving the engagement with Māori. Be it that we're in mental health and addiction services, particularly mental health. We've had a bit of over the last 3 to 4 months, and certainly pre-election, have had lots of media push, and we also are aware the overwhelming workload and the challenges in amongst some of our systems in regards to being able to respond effectively, differently, and appropriately at times for communities of need. So, if we're going to be thinking about a zero suicide approach, a systemic change, and an organisational approach, if we're healthcare practitioners, we need to think about some things. We need to think about some of the distant factors pre-engagement within our respective Māori communities. Some of the things to consider are, do we know as practitioners and services and systems how our local Māori are? Do we understand our communities? Do we have relationships with them? Do we understand how they value health, haura, well-being, life, whānau? Do we? Do we have relationships with them as practitioners and services? What are the belief systems that they have in relation to mental health and well-being? Are we aware of those? Are we also aware of the reputation of the provider? What is the understanding and the belief around your service and provision within your respective community that could be available for Māori? Are they aware of it? Are you approachable? Is your reputation good in regards to past provision of service to Māori at need? Then, of course, there's the power around image, stigma around mental health services and other services which is serviced to the community in regards to self-harm, suicide, mental health and addiction-related harm. And then, of course, these impacts of the communities in which we're living in currently. We see, particularly this year, the impact on homelessness, socio-economic issues, and unfortunately, a lot of my own people in that space. So what are the situations in your own communities that you're aware of? And how responsive are you as a practitioner, your colleagues and profession, and the service to local Māori. So these are some of the distant, pre-engagement motivators, if you wish to call it that, before we even think about coming to your service. Then we think about the immediate motivator. Where is your service? How accessible is it? What is it associated with? Are you in a team whereby actually crisis mental health call-outs are instructed to go to ED or police stations? In a lot of the cases they are in many of these communities. What does that symbolise then when seeking help? We go forward then to think about what is the connectivity with your respective Māori communities? How proximate is it to that local Māori community? Do you have any Māori workforce that can actually engage with people? And is there any aspects in regards to whānau and family involvement, or any policies around that that encourages your service and you to be able to work with people and their whānau? Then of course we think about the design of your service. Many of our services are locked into parameters, referrals, criteria. How does that fit in regards to responsiveness to Māori? And then there's all the other things in terms of contracts. Contracts say we can only meet 3%. We can only service this certain area. But is that going to actually help prevent, early intervene, so forth within the issues that we're seeing in regards to self-harm and suicidality? Now all of this is pre a person contact component, which is certainly a key part of the intervention to make a difference or to have an impact with Māori. All of these stages are also some of the challenges that we're, no doubt, and you, perhaps are also trying to navigate to engage with people who need you, who need to be access to helpful health professionals who can help. And so when we have a look at this then, if we're going to be aspiring to suicide prevention within our practice and within our healthcare systems, there's quite a lot of unpacking that is required to look at what is the responsiveness to Māori and your respective communities. So something to kind of think about, and happy to have further conversations with you when there's a little bit more time. So, waka haurua. Waka haurua will continue to be a national Māori and Pasifika suicide prevention program. We've been fortunate between Rau Matatini and Rau to have another 4-year contract going forward. It will cover the same objectives that we have previously and more. We have found, especially this year, certainly our priority and our involvement is our own people, but we have found this year a huge interest in non-Māori wanting to help, and families and whānau and people in the communities wanting to understand why is it that we want things a little bit different. And we welcome that. And that is also part of the reason that we're participating in this space, supportive of Sean and the kaupapa that has been sort of, I guess, emerging here in New Zealand, which is quite new. So Te Rau Matatini is the National Coordination Centre for Māori Community Suicide Prevention. Our focus is very much within our communities, and we can talk to you if you're interested about what we're doing across New Zealand. Levar, Denise will talk to you about that. Each year we have the opportunity to share what we've been doing retrospectively, and we run what's called a hui whono. We have yet to determine where our one is for next year, but people are invited to those to hear some of the learnings and findings and other things that we're doing, particularly across Māori and Pasifika communities. I'll run down to, we've been really fortunate to create a National Youth Council called Kahui Ururoa. And now this group is very interesting and it's taking us to a different space as adults. For those of us in the audience who are familiar with youth development principles, you'll be familiar with how best to step back and be mentoring and supporting and aligning yourself with young people who are very strategic and are very strong in what they believe needs to have happen to improve in regards to anything associated with youth mental health and suicide prevention programs and the like focused to young people. Over the year particularly, we've been huge hugely blessed by numbers of youth leaders coming forward and saying, no, this is what needs to happen. This is what it needs to look like. And being safe and strong about the key messages that need to have happen in the youth suicide prevention space here in New Zealand. We've been fortunate to really host this group of leaders and who are available to support others in regards to co-design, delivery and development around similar programs. And one of our leaders is here today. Just lastly, you heard me touch lightly on the challenges that we experience in our communities in regards to loss overall, and certainly losses of our people from Australia who have been repatriated back here to our traditional land to rest. We have been able to be supported by the Ministry of Health to unpack, to look at some of the post-vention approaches for our communities that are culturally sensitive and respectful. We will be exploring to see what can be done, if anything needs to be improved across processes and systems, and also looking at how best that Māori communities can be supported, particularly post-loss. So I'm going to leave it there. There's my contacts. If there's anything that's been provocative that I've shared that you don't agree with, I'm happy to have a conversation, and happy to have conversations anyway. So I'm going to pass it over now to Denise. Kia ora koutou.